But you'll have the laparoscopy tray.
Do you mind if I voice record you?
No, that's fine.
Okay.
So laparoscopy tray, some sort of instrument tray. For diagnostic lap, we're gonna do minor tray. And then for lap chole, we will migrate up to major tray, okay? And then you're gonna have the tray that has your scopes. You'll each have 2 scopes, a 5mm scope and a 10mm scope. The ones on that side, they're 0 degree, but this one is a 0 and a 30. Anybody remember the significance of an angled scope? You can get a 360 view, right? You can get a 360 view. With this one, with the 0 degree, it's kind of like a horse with blinders. You gotta go like this, like to see everything, right?
Mm-hmm.
So you'll have those trays that you'll be opening, okay? So I'll go over the contents in this tray, and then I'll talk about some of the disposable stuff, and then we'll work from there. So in this tray, you're gonna find 3 devices that will probably never be in an instrument tray for you. These are disposable. They have white handles. At the end of the case, they get thrown away. Where would you guys throw them? Yes, ma'am. In the sharps. Okay, so this first one here that I'm holding is called a Liga clip applier, and the reason I know that is because it says right here. Okay. This is for clipping any pesky thing that's bleeding or leaking. Okay, so this is essentially like our hemostat, but it stays in. All right, a little bitty clip is going to be loaded into here, but this one has seen its day, so there's no clips. However, these do not come preloaded sometimes, so you want to look in here and see if there is a clip loaded. If not, just pull the trigger to get it ready, because the one thing that you don't want is when the surgeon gets ready to go use it and gets it where he or she needs it and pulls the trigger, nothing happens. All right, so just look in here and make sure. Okay, so that's a clip applier. We also have like the endoscopic version of a hemostat. This is called a Maryland. All right, and it's also sometimes called the curved dissector. All right, so if they want to like separate tissue, dissect structures out, they can do that. It also does rotate this way. Did you notice that it has this little nubbin? All right, this little nubbin is used to hook a cautery cord to it, which is this cord. Okay, it goes on here. And then they can operate it with a foot pedal. So this is one of the cords that you will throw off. And there's a few of these that have them. This little guy has it. Okay. It's monopolar, one pole, monopolar. All right. So that's the dissector. Everybody see it good? When we pass these endoscopic instruments, laparoscopic instruments, we've been like focusing on making you slap it in our hands, right? Slap it in. I want to feel it. I want it to be firm, assertive. This is not really the same, right? You want to place it in your surgeon's hand, but smacking it in their hand is not going to work that well. So just place it in their hand, okay? When they're reaching out, place it. I usually hold kind of closer to the handle end to pass. And then when they're giving it back to you, they're going to kind of be like this, right? And I usually just grab a hold of it and wait for them to take their hand back so you don't like, you know, rip off their thumb. For some reason, they don't like that. So that's the dissector, okay, or the Maryland. And then this one is just like our curved Mets. It's just a little scissor. Recognize that there's this little pole on here that could be used for cautery as well. Okay, so they can make it hot while they're working. It'll cauterize at the same time. Okay. Questions about those 3? Okay, so those are all disposable ones. There's a few others in here that are not disposable. One of them is the probe. I'm going to put that up on my Mayo stand because they're going to use that to dig around in the belly. This one is a grasper, sometimes called the claw. Is that what you said, the claw?
Alligator.
Or alligator, okay. Or the mother-in-law. Notice its teeth. Some mother-in-laws have their teeth filed down, but this one doesn't.
They really do call it that.
Okay.
It's just a big grasper, and sometimes they'll use it to like take the gallbladder, like to grab the gallbladder and pull it out if they're not using a bag or something, or to just hold on to it. Yeah, so that's that one. This is another dissector. Anybody know what it might be called? An animal? Look at the tip of it.
Alligator?
No, look at its little nose. Does it remind you of any kind of nose? Say dolphin.
Dolphin.
A dolphin! You guys got it. We usually call this one the dolphin nose. See, does it look like a dolphin now that
Yeah.
that you know?
Mhm.
The little dolphin.
Mhm.
Could you imagine it having little eyes right here? Okay, another dissector, right?
Mhm.
Surgeon's preference of what would be used. A couple different types of cautery tips, a spatula, and a hook. Spatula and a hook. These are both disposable things, typically. So the hook and the spatula. Is in there. Fucking spatula. This is the one that we're going to be using because it actually, and they have spatulas that come this way too, but this one actually fits right into the bovie.
Oh.
See that?
Yeah.
Okay. I'm going to put him up here because we're going to use him. You don't want to do it right away though. Leave your regular one in there because when they make their little incisions, if there's bleeding, they'll want to, buzz them. So just leave that there. All right. For gallbladders, sometimes there's stones that fall out. This is good for scooping up those little rogue stones. Okay, stone scoop. Okay. And then the only other thing that's in here, this is more of a GYN thing. We call it a Kleppinger. And a cautery cord, a special cautery cord can hook right in here in this spot. All right. And then they can put it inside and then they can grab some tissue with it. Here, let's pretend like this is my tissue. Come on. Right, and then they can step on the pedal and cauterize whatever they have. For tubal ligations, a lot of times they'll use these to burn the tubes. Okay, so that's the laparoscopic instruments. Questions about any of these? Actually, I'm going to put these back in here because I'm going to do a count, so I just want to keep them all together for now. Okay, so that's that. This is one of our cords we'll use later. I'm just going to put him over here. We have our minor tray. We've seen that. Familiar with that. So let's talk about some of these devices over here. So these are the working ports that the surgeon's going to use to move their instruments in and out of the abdomen. There's 5mm one, that's this one. This one's a 12mm one, and the way I know is because it says 12 right there. See that?
Mm-hmm.
It says 12. It says 12 right there too. So this will come in a package kind of like this, and then you'll have to pop it out of the little card that it's loaded on, and you'll just put it together, twist it till it snaps in there. You see these little gray little doohickeys, snaps in. This is a port, and so you want to close it, and we'll talk about why in a second, but this is how you would get this ready. Another really cool thing about this is that if they want to have eyeballs while they're putting it in, they can load the scope in it. And if this was hooked up to the monitor, they'd be able to see as they were like putting this down through the abdomen. And we're going to talk about how they do that blind as well. Okay, so that's one, and it's ready to go. And then the second one, again, the trocar, the sheath and the obturator load together and it just snaps. And then you want to close this guy. Anybody remember what we fill the abdomen with? Carbon dioxide, absolutely. And what is that called? Pneumoperitoneum. You remember that term? Pneumoperitoneum. What is the process of getting that gas into the abdomen called? Anybody remember? Starts with an I. What?
Insulation.